I think by far the most important drug is exercise.
Yeah.
Exercise is a drug because of the wide-ranging effects it has on the body hormonally, physiologically, mentally, psychologically. Exercise cannot be overstated.
Welcome back to another BIOS KOL Sessions. Today we have the privilege of being with the one and only Paul Tortland. He is not only the fittest doctor that practices orthobiologics, but also sometimes the most fun to talk to, and I've seen him do debates at different lectures. So thank you so much for being with us.
Pleasure to be here.
Today we're going to be talking about priming the body for orthobiologic injections. And maybe the first place to start is nutrition. What are your kind of protocols, recommendations, your non-negotiables, if you will?
Right. So that's a very good point, and it's a very good topic because we need to think about if we're going to do orthobiologics treatment, in other words, if we're going to try to help the body heal itself, then at the very least, you want to have the body to have the resources to be able to mount a healing response. You could put the best PRP or the best stem cells into the body, but if it doesn't have the underlying biochemical foundation to respond, then you're not likely going to get the optimum response that you want. And so those underlying foundations are going to be nutrition, and obviously that's diet. But
Sure.
You can also supplement the diet with selective nutritional supplements and strategies to optimize it even more.
Got it.
So first and foremost for me would be making sure that people are getting adequate protein. And the issue with protein is people think they get a lot of protein in their diet, but when they start tracking it with a smartphone tracker, they're shocked at how little protein they're actually getting. And the worst are women and vegans and vegetarians. And I'm not saying that because I have any bias against vegans or vegetarians. It's just a fact that they don't get enough protein. The general rule of thumb for protein is you want a minimum of about 0.75 grams of protein per pound of body weight. So for example, I'm 190 pounds, so 0.75 grams for me would be a minimum of 140 grams of protein.
On a daily basis.
On a daily basis, right. Another way of looking at it would be about 1.6 to 2 grams of protein per kilogram of body weight,
Got it.
whichever metric you prefer to use.
Sure.
Okay. Now what's interesting is a number of meta-analyses. So a meta-analysis for your audience is where they do a study that looks at multiple other studies and then synthesizes the data from those other studies. So numerous meta-analyses have shown that above that 1.6 grams per kilogram or above that 0.75 grams per pound of body weight, there starts to be a diminishing return in terms of the body's response to protein.
Okay.
So for me, I tell people anywhere between 0.75 and 1 gram of protein per pound of body weight. Now, the next question is, how do you get that? People say, I can't eat that much protein. And for me, trying to get that much protein with real food can be a real challenge.
Yeah.
So the best way to get it is with whole food. So just some practical strategies, for example. For breakfast, I'll have 2 whole eggs, half a cup of egg whites, a slice of diced, lean, uncured Canadian bacon, and that gives me almost 40 grams of protein right out of the gate for breakfast.
Okay.
A 6-ounce chicken breast is going to give you 45 to 50 grams of protein. So right there, they're pretty easy strategies. And what I can't get from real food, I will get with protein shakes.
Got it.
So for protein shakes, I think whey protein by far is the best. If you have an allergy to lactose or a lactose intolerance, then you could use a hydrolyzed protein, which gets rid of the lactose.
Okay.
And that makes it much more tolerable. The issue is when you get to vegans and vegetarians. Obviously, the best source, and this has been shown in studies, the best source of protein are going to be your animal sources. And before I go any further, let's take a step back.
Yeah.
We talk about protein as though it's this monolithic, singular thing. The need for protein is not necessarily the need for protein.
Yeah.
It's the need for the amino acids that make up protein.
In the protein.
Right, so proteins are made up of long chains of amino acids. Your typical protein is going to be about 150 to 300 amino acids long. It's the amino acids that the body wants.
Got it.
And the reason that is because the body will then take those amino acids and then reformulate them to make the enzymes and the proteins and the structural components that the body needs. Okay? So the body actually has 2 needs for amino acids. we tend to think of protein and amino acids as being essential for muscle building. But that's actually a secondary function for the body.
Interesting.
All of the enzymes that power all of the reactions in the body are made up of proteins. All of the structure of your body is made up of proteins. Your hormones are made up of proteins. So all of these essential chemicals for life are made up of proteins, made up of amino acids. So here's the kicker, and this is what it really boils down to. If you don't get enough protein in your diet on a daily basis, your body is going to take it from where it needs it less to provide where it needs it more. So it's going to start to steal it from muscle and connective tissue in order to serve the primary functions, which are all the enzymes that power the body. Well, you don't want to lose muscle.
No.
You know, and in our world, musculoskeletal and orthopedic regenerative medicine, we're trying to repair that.
Of course.
If you don't have the substrate, if you don't have the nutritional foundation for the body to respond, you're not going to get the optimum response.
Sure.
So getting back to the issue of animal versus plant, there are 20 amino acids that the body uses. 9 of them are called essential amino acids, and the other non-essential. That doesn't mean that the non-essential we don't need. Essential amino acids are those that the body cannot make. You have to get them in the diet. All of your animal sources have all 9 of the essential amino acids, and in the right ratio for humans. There are only 5 plant sources that contain the 9 essential amino acids.
Okay.
But the problem is they don't have them in the right amount or in the right ratio. And all of your plant protein is very tightly bound up in the fiber.
Okay.
So you have to eat a lot more plant food in order to get the same amount of protein that you would from an animal source. So for example, a 6-ounce chicken breast, to get the same amount of protein from quinoa, you have to eat 6 cups of quinoa.
Ooh, that's a lot of
a
quinoa.
lot of
That's a
quinoa,
lot of
okay?
quinoa. And I like quinoa, but it's a lot.
So if you're a vegan or a vegetarian or you're eating a plant-based diet, you can get the protein that you need, but it takes an incredible amount of effort and knowledge in order to know how to put them all together to get the right sources. Women are also notoriously protein undernourished because they tend to stay away from the sources that are rich in protein because they fear putting on weight. They don't want to increase their calorie intake. And so women are typically undernourished also. So getting back to our original point, this is why I really hammered that point home. Make sure you're getting adequate protein, particularly when we're trying to repair cartilage, tendons, ligaments, muscles. You need that to build those.
Sure.
So that's the first and foremost.
And you mentioned protein supplements. I've also seen amino acid supplements. Is that something that you add to, or would you be able to get most of your amino acids just by getting a healthy amount of protein from your diet plus the supplement?
That's a great question. And it's a great question because there's a tremendous marketing effort out there for people to buy branched chain amino acids and essential amino acids. If you're getting all of the required protein in your diet, absolutely no need to spend your money on any other amino acid supplements. If you are going to supplement with amino acids, meaning that you can't quite get the full amount of protein, then at least take an essential amino acid supplement. Not a branched chain, but the essential amino acids, which are those 9 essentials that the body can't make.
Okay. And is there, I guess, the sweet spot for timing during the day when you want to have the protein shake? Is it before a workout, after a workout? When do you see the timing through somebody's day when they should be supplementing?
Yeah, so that's actually been looked at in the research also, and they've shown that there's really no difference in terms of when you time it, but the key is how much protein you're getting at any one time. So let's say that you're doing, for example, intermittent fasting, and you're limiting your feeding window to an 8-hour feeding window. It's really hard to get 140, 150 grams of protein in that 8-hour window. And if you're eating more than about 50 or 60 grams of protein at one meal, then your body's not going to get the maximum benefit from that. So you're better off having 3 or 4 evenly spaced meals throughout the day. In terms of timing around your exercise, I remember back in the day, people would bring a protein shake to the gym, and as soon as they're walking out the door, they're chugging out because they thought there was this anabolic window. That's been completely debunked. As long as you're getting the protein throughout the day on a regular basis, there's no compelling reason to have to specifically time it. Now, in my case, I work out first thing in the morning. And that means I've gone through an 8 to 10 hour fast between dinner and working out. I work out typically at about 5 in the morning. So I'll put a scoop of essential amino acids in my pre-workout drink.
Got it.
So I'll have that, then I have a little, devotional prayer time, and then I go to the gym. And by that time, those amino acids are already starting to get absorbed. But otherwise, there's no reason to, and then I have breakfast when I get home after I shower. But as long as you're getting it throughout the day. So, but the key is,
Sure.
you have to get it on a daily basis.
On a daily basis.
Okay? Your body is very, very good, as your audience probably knows, sometimes unfortunately so. We can easily store carbohydrates and fat.
Sure.
Your body
Way
can't-
too easy.
Way too easy, right. We all suffer from that,
yeah.
okay? Your body can't store protein. So
That's
you
what it is.
need it on a daily basis. There was a really interesting study where they had people eat the same amount of calories over the week and the same amount of protein over the week.
Yeah.
One group fasted every other day,
Okay.
so a complete fast. The other group, free range eating. But both groups were equated for calorie intake, protein, carbohydrates, and fat.
Yeah.
And what they found was that the group that fasted every other day actually lost protein and muscle mass
Interesting.
because you can't store it.
Can't store it.
So you really have to get it every day.
It's interesting you bring this up. I think in the U.S. we've had an issue with nutrition, and I myself, before I had a big knee surgery, I started to track my protein. And number one, you're absolutely right. I was way under what I thought.
Yeah, surprising.
Yeah. Two, I had to make a very an effort on a daily basis to meet my protein goal. It's something that you have to work at.
Yes.
And then I started looking at my kids and what they were eating, and I was like, oh my God, they're definitely not getting enough protein.
Right.
So I know this is obviously about orthopedics and orthobiologics, but I think also we have a role to play in terms of teaching our kids how to eat better, right? And maybe tracking some of the things that they're doing a little bit better.
Absolutely.
Right?
Yeah.
And I think another big change has been in nutrition is identifying. Before we were big on low-fat diets, right? And now we know that it's really the sugars and the processed foods that are in the meals that we're eating that really have been the problem. Would you agree with
That's
that?
100% accurate. There's no such thing as an essential carbohydrate. There's not.
Yeah.
Your body can do perfectly fine without eating carbohydrates the rest of your life. You need fats. Fats are absolutely essential because fats fuel your hormones. Okay. I remember at one point I was on an ultra low fat, ultra low carb diet. I got down to 10% body fat. I was really lean, and I noticed I was having difficulty concentrating, focusing. My mental sharpness was starting to fall off. As soon as I put fats back in the diet, everything cleared right on up. So fats and proteins are essential. Carbohydrates are not.
Or not.
Okay? And if you're going to choose to use carbohydrates, which I do, I'm not an anti-carb person, at least choose the more complex carbohydrates rather than the simple ones. So.
All right, so we talked about if a patient comes in, obviously we're going to talk about protein, protein supplements, amino acids. What supplements would you put or talk to someone about before a biologic injection? How long do you want them to take it before the injection? And what do you think is the role of drawing labs, or which labs to draw to see where this patient is at on the spectrum?
Got it. So those are really wide-ranging questions. Let's focus on the nutritional supplements first.
You got it. Yep.
And the way you phrased your question, I'm going to break that out a little bit.
Thank you.
I have a handful of what I consider non-negotiable supplements for everybody. And then there are some supplements that I would want people to add if they're getting ready for an orthobiologics treatment.
Okay.
So my non-negotiables for patients are omega-3 fish oil, vitamin D3, and magnesium, either as citrate or glycinate. So why? Omega-3, absolutely essential. It's essential for building the cell membranes. It's essential for controlling inflammation. It's essential for cardiovascular disease. You almost can't take too much of the omega-3 fish oil. The one exception is you wouldn't want to take it if you are on blood thinners.
Got it.
Like Eliquis or Coumadin, warfarin, Plavix, any of those. Okay.
Got it.
Second would be vitamin D.
Okay.
Vitamin D is an interesting vitamin because when it gets metabolized, it's actually not a vitamin, it's a hormone. And vitamin D is responsible for the expression of over 5% of the genes in our body.
Yeah.
So if you're not getting enough vitamin D, then 5% of the genetic expression is going to be compromised.
That's crazy.
It's that
Yeah,
important.
that's crazy. Yeah.
So the lab that I use is Quest. I don't have any financial interest in it. That's just the one that's in our area. And the normal range for vitamin D on Quest is from 30 to 100. Okay.
Yeah.
I like to see people up in the 60 to 80 range of the vitamin D. You know, I make a distinction between what's normal and what's optimal.
Sure.
You could be 35.
Be
That's
normal.
technically
Yeah.
normal, but that's like going around with an eighth of a tank of crappy unleaded gasoline in a high-powered Ferrari. you
Right,
know?
yeah. What's
It's
the
just
point?
not gonna
Yeah,
work.
yeah,
Right. So vitamin D is number 2. Magnesium is really important because it's essential for repairing the damage to your DNA and RNA.
Okay.
So magnesium is absolutely. Women need 300 to 350 milligrams a day. Men need 400 to 450 in divided doses. If you take all your magnesium at once, you're going to get the squirts.
Yeah.
So you're going to get loose stools, okay?
Yeah.
I also like magnesium at bedtime because it helps with sleep.
With sleep.
So, and I prefer those forms, glycinate or citrate. There's another form out there called Magtene or Magthreonate. That's okay, but not as a substitute for the citrate or the glycinate. So those are my non-negotiables for everybody. If somebody's getting ready for an orthobiologics treatment, then I want them to add fairly high doses of vitamin C.
Okay.
And the reason for vitamin C is vitamin C combined with protein helps form collagen. And collagen is what makes up muscle, connective tissue, ligaments, tendons. It even contributes to cartilage.
Okay.
So adding that vitamin C can really help your body with the resources to build and repair those connective tissue structures.
Got it. And what about collagen supplements?
I was setting you up for that question. Okay? The issue with collagen is it is not a complete protein.
Okay.
Most collagen supplements contain glycine, proline, and hydroxyproline. That's 3 out of the 20 amino acids. If you are getting an adequate protein in your diet, you're getting that 0.75 grams per body weight. There's absolutely no need to waste your money on a collagen supplement.
Okay.
There is one exception, and this has some weak support in the literature. If you have symptomatic osteoarthritis, okay, that means you've got pain in your joint from arthritis, there's some evidence that a collagen supplement on top of an adequate protein diet can help with the symptoms of osteoarthritis. So otherwise, completely useless for hair, skin, nails, any other of the things that they are marketing collagen supplements for. The data is completely clear, complete waste of time.
Interesting.
Yeah.
Well, you brought up osteoarthritis. What about glucosamine? What do you think of glucosamine supplements for arthritis?
So I actually take glucosamine and chondroit, and I've got advanced arthritis in my shoulder, and I've got a little arthritis in my wrist. So I think there's value to it. I think it's hit or miss in terms of how well people respond to it. Some people do really, really well. Some people really don't notice anything. As with so many things, brand matters. I'm not here to promote any brand, but there are some brands that are very high quality and others that have been shown not to have any glucosamine or chondroit in them at all.
It's a placebo.
Exactly. They have done tagged studies where they tag the glucosamine and chondroitin molecules with a little radioactive tag so they can follow it in the body and see where it ends up. And they do end up in the cartilage.
Okay.
So that's been proven. People say, oh, well, it just gets excreted in the urine or the stool. No, it actually gets incorporated.
And so a lot of these supplements that you're bringing up are the oral forms. We've seen a lot of IV therapy clinics, things of that nature. Do you see any benefit at all of taking some of these things IV? Or do you prefer strictly oral?
I think, again, if you have a well-balanced diet and you're otherwise healthy, the oral forms are perfectly acceptable.
Okay.
Have there been times where I've had IV treatments? Yes, my wife and I both got COVID at the same time, and we were really sick.
Yeah.
I've never been vaccinated. I never will.
Fair.
But nonetheless, I got COVID. We were really sick, and we went to one of these IV places. And I got, a bag of IV amino acids, glutathione, high dose vitamin C, completely turned me around. And the reason that was beneficial is my body was not going to be able to process enough of the vitamins orally to get it into my system.
Okay. You brought up glutathione. Have you looked into NAD at all or NR, any of those supplements?
I'm starting to get into that.
Okay.
I'm starting to morph now into the peptide realm.
Okay.
And so that's where I'm starting to explore a little bit more of this.
Yeah, the peptide world is interesting. I have so many patients pretty much on a daily basis that ask me about it. And I think for our purposes, there's either going to be the wound healing peptides like BPC 157, TB 500, and then the growth hormone secretagogues, right? To try to help build muscle.
Right.
Have you implemented that yet to your practice? I know it's kind of a little bit of a polarizing subject. Where do you at on it right now?
Well, first, for the sake of your audience,
Yeah.
let's talk about what are peptides.
Thank you.
So peptides are actually short protein chains. So at the very beginning, I said most proteins are 150 to 300 amino acids
Yeah.
long. By definition, peptides are going to be 50 amino acids or shorter. Some peptides are only 3 amino acids.
Okay.
The most famous peptide, for the sake of your audience, is insulin. Insulin is 51 amino acids. Ozempic and Mounjaro, the GLP-1 agonist, those are peptides. We do carry oral BPC 157 in our office. When I had my shoulder surgery, I had cartilage repair. I injected BPC 157 around my shoulder, and my recovery rate within 3 weeks, I was phenomenal.
Yeah.
I was back in the gym actually
Great.
lifting.
Yeah, it's
So I'm a big fan of peptides.
Yeah.
One of the problems with peptides is that the FDA has clamped down on them, and it's really hard to get many of the peptides. They are available, but they are available for research purposes only. I still will use them, but I'll let the patients know that this is not an FDA approved product, and I have them sign a waiver that they understand this is not FDA approved. For the sake of our discussion, I think the BPC 157 is very good, particularly in combination with the TB 500. Those are great for stimulating, particularly connective tissue and soft tissue repair. By the way, BPC is one of the few that you can take orally because it's isolated from stomach
In the
juice.
gut.
So it's stable in the gut, and so you can take that orally. Particularly if your patients have GI problems, ulcerative colitis, Crohn's, some, irritable bowel syndrome. The BPCs are great for that.
Right.
And
do you like to see them do a cycle, or is it kind of patient dependent, whether they're on it for 3 months or for the whole year? Kind of what are the cycles that you see with these?
So that's really going to be dependent peptide to peptide.
Exactly.
So for the BPC, I like to have them on for about 8 weeks and then stop for at least a month.
Okay.
And here's the reason why. Peptides and then these smaller molecules that are known as bioregulators, they're signaling or stimulating molecules.
Yeah.
They're trying to turn on machinery in the body to do things. If you're taking these all the time, then your body starts to adapt to it, and it's no longer going to respond. Okay? So you have to cycle them so that the body will continually respond to it. Some peptides, for example, you would do a 6 or 8 week course and then not take it again for a year or maybe 6 months. Other peptides that I'm getting into would be like, for example, GHK-Cu, or also known as GHK copper. That's great for skin and hair. You can get a topical form.
I probably need that.
Yeah, right. So do I. But I do a lot of PRP hair treatments and PRP
great.
facials. A lot of women's cosmetics have the GHK-Cu in the cosmetics because it helps with the skin. And you can get a topical form that you can either put in your PRP when you're doing your injections or have the patient apply it topically.
Got it.
And then, of course, there are the growth hormone secretagogues. So that would be sermorelin, ipamorelin, tesamorelin, for example. Those have to be injected, and you would cycle those as well.
And I think tesamorelin is the one that is FDA approved for HIV-related lipodystrophy.
Exactly.
That's a mouthful.
Yes.
But do you think that, in a general sense, and I know you're not a regulatory attorney, but does that give us the ability to use it off-label because it does have, FDA approval essentially?
Absolutely.
Okay.
So as physicians, we can use any medication for any indication that we want as long as it's an approved medication for some purpose. So physicians use medications all the time off-label.
Off-label,
So, but that's in our license. We're allowed to do that.
Yeah, I see a lot of benefit in terms of just from a mechanism of action. I think it makes a lot of sense. These are going to be synergistic treatments that we're doing with our treatments, right?
Absolutely.
They make total sense. Even I think after big surgeries, right? If someone had a knee replacement or even a cuff repair, if they're going to lose muscle mass or immobilize for a while, these things can certainly help.
Absolutely.
Yeah.
I mean, you look at what happens when you immobilize a joint. The loss of muscle mass within 2 weeks can be as much as 40%.
Yeah.
It's incredible. It's incredible how hard it takes to train to get there.
Sure.
And it's
lose
really discouraging how quickly you lose
Yeah.
it. What's interesting, though, is the research has shown that the more adapted you are, in other words, the more muscle you are, the more that you are doing weight training, you recover much faster than somebody who has not been exercising on a regular basis.
So it does make sense, sort of, if you're going to have a big surgery, to do a prehab, right? And try to get as conditioned as possible before the surgery, since potentially you're going to lose muscle mass to get some of it back. Would you agree?
Right, as long as you have the ability to do that.
Sure.
Right.
Yeah, sometimes that's the
you don't
point
want to
of the
do the
surgery,
exercise
right?
that's going to make
You
you
can't
worse.
do it.
Right.
Yeah.
But yes, you're absolutely
Yeah.
right. I like the concept of what I call prehabilitation as opposed to rehabilitation. You're setting yourself up for having the best outcome by doing stuff before the surgery so that you have a better outcome afterwards.
Well, let's get into hormones a little bit. What are your thoughts on testosterone in this same setting? Obviously, we can look at it just from a general wellness perspective, longevity, just maintaining your muscle mass. But where do you see it fit in, pre-procedure, post-procedure, or, around surgery?
Sure. Testosterone is phenomenal. And it has gotten a bad rap over the years because of misinformation and a lot of myths that have surrounded it. Men and women both need testosterone. I joke, I say women need a thimbleful, men need a bucketful, but we all need it. We tend to think of testosterone more in the world of libido and sexual response, but that's actually a smaller component of what testosterone is responsible for. When you have optimized testosterone levels, your insulin sensitivity improves, you maintain more of your lean muscle mass, your cognition is better. Basically, every system in your body responds better when your testosterone levels are optimized.
Okay.
So I'm a huge fan of that. And here's one of the big myths that I want to dispel. This has been dispelled, but I can't hammer this home enough for your audience, particularly for the men. Testosterone does not cause prostate cancer. End of story, 100%. That is completely debunked.
Yeah.
If you are on testosterone and you develop prostate cancer, it is not the testosterone.
Yeah.
You would stop the testosterone, but it's not the testosterone that caused that to
caused it.
happen. I mean, think about it rationally. If testosterone caused prostate cancer, virtually every 18 to 20-year-old would have prostate cancer.
Right.
Because that's when our testosterone levels are the highest. So I just want to debunk that.
And I think that's been looked at in large volume of men, the studies that have been looked at, right?
Absolutely.
Yeah. It's not like small trials that they look. These are thousands of
Huge
patients, right?
studies, yes, completely debunked.
What about cardiovascular disease?
So
That's the other one, right? You see the bodybuilders, or that maybe are combining it with other things, or maybe in the 80s they were having issues,
Right.
Where do you see that?
Right. So you're talking about physiologic testosterone supplementation versus supraphysiologic. So physiologic is just replacing what the body needs. The bodybuilders are doing supraphysiologic, and that's where you get into trouble. As with anything, as the ancient scientist Paracelsus said, the difference between a drug and a poison is the dose.
Yeah.
Or as we say in today's world, the dose makes the poison.
That's it.
So too much of anything, heck, too much salt, too much water could kill you.
Sure.
Okay? So if you're taking testosterone way above and beyond what your body needs, yeah, you're going to get osteoporosis, you're going to get liver disease, you're going to get cardiovascular disease. That's not what we're talking about. So when I do testosterone supplementation on men or women, first I get baseline labs. I want to see where they are. How do you know where to go if you don't know where you are?
Right.
Okay, so I get the baseline labs. And in men, I also check their PSA to make sure their prostate is healthy. Okay, then we supplement. And I follow the supplementation with the labs. Again, I want men up in the higher end of normal. Now, not to get too far into the weeds, but one of my big beefs with modern physicians, particularly primary care doctors, and even the endocrinologists, is they only look at the total testosterone. I look at the total and the free testosterone. So for the sake of your audience, what's the difference? Total testosterone is measuring the entire amount of testosterone that's in the body. The problem is testosterone as a hormone does not travel through the circulation. It's not soluble in water, and blood is basically water. Okay? So all hormones, including cholesterol, which is a hormone, has to be bound or piggybacked onto a protein carrier in order to travel through the body. What's ever bound to that protein carrier now can't be used by the body. So imagine that you've got Amazon packages in the back of a pickup truck. You can see the Amazon packages, but Have you taken hold of it yet? No. As long as it's sitting in the bed of that pickup truck, you can't use it. So the total testosterone is measuring that total amount in the body. The free testosterone is measuring the unbound portion that is now available to be used by the body. And the reason it's important to check both is because as we age, the total testosterone stays the same early on, but the free testosterone starts to drop off around 40 years old.
Okay.
If you don't measure the free, you're going to miss that early drop in testosterone.
Got it.
So you've got to look at both. And in fact, even though I look at both, I'm really focusing on that free testosterone because to me, that's the number that matters.
That matters.
And like we talked about earlier, I like to have everybody in the higher end of normal.
Got it.
So-
Now, what is the difference between like low T on paper versus symptomatic hypogonadism? Is there a difference there? Do you treat someone with low T that doesn't have symptoms, or maybe they don't realize they have symptoms? What's your algorithm to deciding, okay, do they need supplementation or not?
Well, that enters the, or asks the question, why would you be getting labs in the first place if somebody doesn't have any symptoms?
Correct.
Okay?
Yep.
We see that, for example, with osteoarthritis. I mean, you're a physician like I am. We treat these people. How many times do you see patients who have complete bone-on-bone x-rays and they don't have any symptoms?
Yeah, yeah.
We see that all the time.
Absolutely.
So there are people who are doing quite well on low T and they're functioning perfectly fine. So it's really the symptomatic ones that we're looking at, and those are the ones we want to try to optimize.
What are your comments on, for instance, the concern that, okay, if I start testosterone replacement, then I won't be able to get off of it? One, because I'm going to feel better, right? I think I'm going to like it. But if I commit to it and then I get off of it, I'm going to crash, then I'm going to have a bad time with it and want to get back on. How do you manage that conversation?
So I manage that by taking a look at who am I treating. If it's a younger man who still has the ability to produce testosterone, then I might give them something that will help stimulate the natural testosterone production. For example, you could give them HCG, human chorionic gonadotropin, which will squeeze the testes to produce a little more testosterone. That's particularly important in younger men who still want to have a family.
Right.
Because if you supplement with testosterone, it can decrease or stop sperm production.
Got it.
But the next step of that is, as we get older, our bodies are no longer producing testosterone. So, okay, you get off it, so what? You're not making it anyway. So why not just supplement it, Are there reasons that I would want to stop testosterone replacement? Obviously, one, if somebody develops prostate cancer. Although, interestingly, there's a new paper that came out about 6 months ago looking at advanced stage prostate cancer, treating men with what they call bipolar treatment. Bipolar treatment is they put them on an aromatase inhibitor like dutasteride or finasteride, which is what they do for prostate cancer. But at the same time, they're treating them with high-dose testosterone, which is really, really interesting. So, so when would I stop testosterone replacement? If they're having untoward side effects, in other words, they're too emotionally labile, because testosterone can make you a little bit more emotional. You may find yourself weeping at a movie that you wouldn't normally weep at. But some guys develop a condition called erythrocytosis. Erythrocytosis is an elevation in your red blood cell count. Okay, and that is a potential side effect of testosterone. You can address that one of two ways. Either therapeutic phlebotomy, go and donate blood 3 or 4 times a year, works great. Decrease your testosterone dose, but now you run the risk of losing the benefit of what it's doing for you. Or you have to stop the testosterone altogether.
What is your go-to? Is it intramuscular, like testosterone cypionate on a weekly basis? Do you like to do smaller daily injections, pellets? What's your go-to?
So there are 3 main ways to get testosterone supplementation: topical creams or patches, injectable, or pellets. So let's go through each of those. The topical creams are okay, but I found in my experience they're not enough to get you into the optimum level. They're good enough to get you from suboptimal just over the line into acceptable normal, but they're not going to get you up into that optimal range. Okay, and about 10% of the population does not absorb through the skin very well. Okay, but for some guys it's a great option. Okay, second option would be injectable. Injectable has a couple of different ways of administering it. The most common way would be an intramuscular injection, typically in the butt or the hip, once a week. Okay, that's okay, but it's not physiologic. How does your body secrete testosterone normally? There's a little secretion every morning about 2 or 3 o'clock in the morning. So your body is secreting testosterone daily. So to do a one big injection once a week, you get a big spike in your serum levels, your blood levels. And then over the next few days, it slowly drops off. And by the end of the week, you're almost back down to zero. So for the first couple of days, you're like, whoa, I'm jazzed. And then towards the end of the week, you're dragging your can, okay? So it's acceptable, but it's not okay. A way around that is to divide that weekly dose and inject twice a week. But now you got a double camel's hump, okay? What I really prefer, because I think it's much more physiologic, is inject a very small amount subcutaneously, so just under the skin, every day. So if you take that one week dose, which would be 1 milliliter, 100 milligrams, 200 milligrams, whatever. If you divide 1 milliliter by 7 days, it's 0.15 milliliters. That's a really, really small amount. You inject that with an insulin syringe every day. It's a painless injection, and yet your levels are just staying rock solid. And it's easy to adjust the dose also. You don't get the ups and downs. You just feel great all the time. Once in a while, I'll skip a day. And I'll skip a day just so my body isn't used to seeing the same level all the time because of the adaptation that we talked about. Okay. And then the third way is implantable pellets. The advantage of that, set it and forget it.
Yeah.
You have the pellets put in, they last on average about 3 months, and you don't have to worry about it. The downside is it's a minor surgical procedure. It's much more expensive than the other options, and you can't adjust the dose. Once the pellets are in, they're in, okay? And as the pellets wear off over time, you're starting to see your symptoms drop off towards the end of the pellet cycle. So.
Gotcha. That's amazing. So we talked about nutrition, we talked about peptides, testosterone. Let's close with any final recommendations, to optimize the body before or after a biologic injection.
I think by far the most important drug is exercise.
Yeah.
Exercise is a drug because of the wide-ranging effects it has on the body, hormonally, physiologically, mentally, psychologically. Exercise cannot be overstated. My frustration with exercise is you need to do both cardio and weight training.
Yeah.
Most people aren't doing weight training. If you had to choose between the two, weight training is more important than cardio. And if you do your weight training properly, your heart rate's going to go up. Also, as we age, you are going to lose muscle mass much faster than you lose cardiovascular status. And it becomes harder and harder to regain that lost muscle as you age. So I think exercise is by far the best drug, not only for preparing for orthobiologics treatments, PRP and stem cells, and for recovering from them, but also from a longevity perspective. To put things in perspective, starting around age 40, we will lose about 1% of our lean muscle mass every year. So by the time you're 80 years old, if you manage to live that long, you've lost 25% of your lean muscle mass. That's just outstanding.
Yeah.
The more muscle mass you have, the more calories you're burning at rest. It increases your insulin sensitivity. It supports all of your internal organs, keeps your blood pressure under control. I mean, there's no downside to it, So I think if I could get everybody exercising, particularly weight training, before, after, and for the long haul, I will have done a good service to society and mankind.
Exactly. Well, thank you, Paul, so much.
My pleasure.
This has been amazing.
Thank
you so much for your time.
It's been a lot of fun.
Hope you guys enjoyed it. Please remember to subscribe and like if you want to follow this content. Paul, you're the man.
Thank you, sir.
By the way, how many pull-ups are you doing right now?
Weighted or unweighted?
Weighted.
Weighted, so with a 45-pound weight strapped on my waist, I can knock out about 11 at a time.
Yeah.
Just bare with no weight at all, I can probably get about 50.
I'm telling you, the fittest
Not
regenerative.
bad for a 66-year-old.
Yeah, the fittest regenerative doctor in the U.S. Well, thank you guys. Until
Thanks
next
a lot.
time.
Appreciate it.